Hi, what brings you here today?
I've had a cough for about a week, and I have some green congestion, and in general, I don't feel well.
Okay, what does the cough sound like?
It's a wet cough, but I don't have any phlegm
Did it
coming
start suddenly, or what time of day do you notice it?
About a week ago, it started, and it's at night.
Okay, are you taking medications for it?
Just taking Tylenol for pressure and pain above my nose in this area, even my teeth.
Have you had a fever?
I had a fever for about 3 days at 102.
Okay. Do you have a history of like allergies, asthma, any chronic respiratory things I should know about? Family history, perhaps?
No.
Okay. Where do you live and what is your job?
I live in Miami in a private home with my husband. I used to work in an office environment. I'm retired now and take care of 3 children under 6, my grandchildren.
Okay. So are you updated since you take care of children on your flu and pneumococcal vaccines?
Yes.
Okay. So have you traveled recently?
Went to the Bahamas about a week ago.
On a cruise?
Yes.
Okay. So it's always important to ask. Different countries are associated with different respiratory viruses. And, being on a cruise puts you in close quarters for quite some time with people from all over the country, if not world. So right now I'm going to assess her sociocultural factors. For example, Asians are more prone to TB, as are the homeless population and those in group living. So her age group, they decrease respiratory muscle strength, their coastal cartilage calcifies, and their elastic properties decrease. So it's harder for them to inflate their lungs. This decreases their coughing ability and increases their secretion. So they're going to be more prone to infection and electrolysis. So we always want to, they have less gas exchange, so you always want to assess for dyspnea. Are you feeling short of breath?
No.
Okay, good. Is it affecting your daily life, what you're going through?
Not too much, but since I don't feel well in general, I'm in bed a lot.
Okay, so let's begin our exam. We're noting that the room is warm, the patient is gowned, it's open to the back. My stethoscope is cleaned and warmed. So I can see just by looking at her that the patient is breathing at a normal rate and effort. Countering her respiration rates. She's in a normal position. A tripod position might indicate COPD, but she looks fine. I'm looking at her nails and her lips, no signs of cyanosis. So let's turn to the back. Okay, so her shoulders, her hips, and her spine are all symmetrical and straight, so no issue with scoliosis. Her anterior posterior diameter is half of the transverse. If it were equal, it might be indicator of barrel chest, which is COPD. So now I'm going to do the symmetric expansion test. You put your hands in kind of a W, place them over T9. You pinch near the vertebrae, take a deep breath in, and take a breath out. So your hands should do the kind of this pattern, which would indicate good lung expansion. So now I'm going to do tactile fremitus. Ma'am, you're going to repeat this number 99 when I place my hand on you, okay? Go ahead.
99, 99, 99, 99.
And you're going to do this all the way down at 5 points, side to side. Basically, you're feeling the vibration from her speaking. And you can do this anteriorly and posteriorly as well. So issues with obstruction, like emphysema, might decrease it. Issues with lung density, like pneumonia, might increase it. And then, of course, rhonchal is the feeling you'll feel when air is passing through thick secretions. Now we're going to go along to percussion, which involves tapping the areas in a similar fashion, up by the shoulders, and then 8 points on either side down the back. Basically, you're listening for a sound. It's like a hollow sound they call resonance. So a hyperresonance may indicate emphysema or pneumothorax, while dull would indicate perhaps a tumor or pneumonia. And you want to stay away from, of course, bones and organs, which would change the sound as well. Then we're going to do diaphragmatic exertion. So as you're palpating down, percussing down, I'm going to ask you to take a deep breath in and then out and hold it. And then as she's holding it, wherever the sound stops, or changes, I should say, you mark it. And then I'm going to say continue, take a deep breath in and hold it, percuss down, and then you mark where the sound changes. You do the same on the other side, and then you can measure between the 2 lines, and for the adult it should be 3 to 5 centimeters. So now we're going to take the time to auscultate. You want to make sure she's seated up, facing forward, leaning slightly forward, and then mouth slightly open. So you follow a similar pattern. Take a deep breath in and out. Again. You want to compare side to side all the way down the back and around the lung field. So you're looking for adventitious sounds like wheezing, might be an indicator of asthma exacerbations, or crackles might be an indicator of pneumonia. You can also take this time to auscultate the front of the chest wall, listen to the voice, make sure it sounds soft, muffled, yet distinct. She sounds clear. I hear like a light tint of like referred sounds, possibly from upper airway congestion. So that, in combination with the other symptoms that she mentioned, lead me to believe that it might be a sinusitis. So at this time, you can kind of palpate along just to kind of confirm any tenderness and take a look in her mouth, assess the back of her throat, see if there's any evidence of a postnasal drip. Thank you.